Hello and welcome to Saroma Shorts. Today we're talking about why someone would want to set their own practice up rather than buying an established practice. Dan, what's your take on this?
Yeah, so we speak to a lot of clients who are looking to start up, and I think it's quite a hot topic at the moment because there's a lot of people interested in doing it. I think the benefits of starting a practice is you get to choose the location that you want. So you can pick something that suits you, fits in terms of your work-life balance, and you get to design it how you want, so the exact layout, and also you can do the branding from the start. So you can brand the practice exactly how you want. And also the other benefit is setting up a practice can be a lot cheaper than buying someone else's goodwill, which can be quite expensive at times.
It's also true, isn't it, that many of our clients that we funded to buy an established practice end up completely refurbishing the practice within the first couple of years anyway, and kitting it out with new equipment. So sometimes it's probably nice to do it for yourself at the beginning. And so you mentioned the cost of setting up then, so the finance costs. I mean, how does the finance work generally in this world?
Yes, so lenders are very keen to lend to people for startups. Normally, they'll do sort of 70% of the overall startup costs. So, if you're setting up for around 350,000, they'll do 70% of that, which is around 245-ish, roughly. So, thank you very much. Thank you very much. So they'll do that for you. They'll normally do it over the term of the lease. So if you've got a 15-year lease in place, they'll do the loan over 15 years. And the good thing with startups as well, because banks understand they need to help you from the start to build up that income, they'll normally happy give you like a interest only period for a minimum of sort of 12 months, which really helps because obviously you can then focus on growing that business and you're only paying the interest each quarter instead of having to make capital and interest repayments. So it's really beneficial for someone at the start when you're looking at your costs.
Yeah, it's quite generous actually, isn't it? There's probably no other sectors that can obtain startup finance like that. So that is good. And also, I guess the other added benefit is that after a few years, you've built the goodwill value up and potentially your finance levels are quite low compared with someone who's bought a practice for $1 million and borrowed maybe 800,000.
Yeah, and I suppose the thing as well, sometimes when you're doing startup finance, it may be a little bit more costly in terms of the rate than if you're buying an established practice. But like you just said, once you've set it up, you've built up that income, lenders are happy to have another look at it. So although the rate might be slightly higher, you're not going to have to be on that for sort of 15 years. After a couple of years and you've got a set of accounts, the bank's policy shifts and suddenly you're an established practice and you could refinance that debt again and get a lower rate. So it's useful for that vehicle to set up the practice, but it doesn't mean you're going to be on that for 10, 15 years. You can always review that at a later date.
Yeah, of course, refinance is a huge topic at the moment. And I guess people could, at that stage, once they've got the goodwill value there, refinance the existing debt, potentially borrow a little bit more to kit out more of the premises if there's a big premises, or even start again and do a second practice. So there's always that option.
Yeah, and I suppose the other thing as well, because when we're talking to people about setting up, we try to talk to them about sort of keeping control of your costs. And your point there is quite key, is that you may have only set up the one surgery to start off with, but as it's grown, you might need some more finance to do the second and the third surgery.
Well, I'm glad you mentioned that, because what are the downsides of setting up?
Well, the downside you've got of setting up a practice is that you're starting from scratch, aren't you? You haven't got that patient base, you haven't got the practice set up. So you're going to need to sort of, engage a lot of people to set the practice up. It could take, 6 months to get all the planning and, have everyone in place to help you with that. So that is a bit of a downside because, if you're buying an established practice, go in there day one, you've got that income. What we're finding, I suppose, with a lot of people on who are setting up is they're sort of building that patient base in the background to start off with. So they're using their social media. So people are finding them and they go to the practice where they are at the moment because they like that dentist. So if they're using their social media right, people will find them. So it does make things a little bit easier in terms of the income. But
of course, yeah. I mean, I guess
yeah,
it's also a bit of a stage. That's what I was aiming at. Really, it's a bit of a staged process, isn't it? You might set one surgery up first, then
yeah,
18 months down the line, you're setting the second one up. So you've got to have the appetite for that, and for the building project at the beginning, which is not for the faint-hearted. And sometimes the cost overruns. It's a whole job in itself, managing a building project.
yeah. It's the startup's not for everyone. You know, sometimes someone might think, oh, startup's great. It's a low cost way to own my own practice, but there are a lot of other things that they need to think about. And you know, I've spoken to clients, and yeah, I want to start up a practice, but then suddenly they're flipped to buying a practice because it's an easier route and everything's set up for them. But there are things, like you said, things that you need to do and think about when you're setting up. Yeah. So when you're thinking about it, yeah, do the one surgery. You know, you don't always need to do 2 or 3 surgeries at the same time. You may have people say, oh, it's easier to do it at the start. But if you're spending another 50,000 on the surgery that you may not be using at the start, that's money you've paid out for, and you're going to have to, you know, pay interest on it. You're better off phasing that in later on when you need it, and you've booked that first surgery up to sort of capacity as well. And then also, if you're leasing as well, it's always useful to talk to the landlord that you're leasing from, because again, at the start, you're trying to keep control of the costs. So like I said about the interest only period, that's great from the banks. But if you can get a rent-free period at the start, again, that takes a lot of pressure off the business, because if you can get a 6 months rent-free period, you will sort of, you know, have some extra money to build up that patient.
In 20 years, we have funded numerous squats between us. What's our experience of this?
Yeah, very successful, really, if they're done in the right way. If you've got to keep control of your costs, you know, sometimes there's, you know, the things that you want and the things that you need. And I think you need to sort of put those in the right boxes, you know, because it's, I want this, I want that, I want this scanner, but you don't actually need those at the start, really. You just need the dental chair, your decon room, your reception. And then the other thing as well is the finish. Yeah, it's normally going to be a private practice, so they have to have a good finish. But do you need to spend £10,000 on a receptionist desk? It may look nice, but that's not generating you any income. So it's really keeping control of the costs, because again, if you can control that, then it allows you time to build up that patient base. And then once that's built up, then yeah, maybe you can splurge a little bit more on some things for the practice. But you need, the main focus has got to be building that practice up. And once you get to that point, then obviously you can sort of expand and do the other surgeries that you need.
Yeah, I think my own experience has been that thankfully, I can't think of any, in fact, that have failed. They all worked. There were a few wobbles, and it was always the same reasons. It was perhaps the dentist giving up their associate job and and believing the squat practice was going to pay them a salary if they sat there all week. Times have changed a bit, though, that said, because as you just mentioned, social media means that clients do tend to roll in a little bit quicker. But I think you've got to be mindful of keeping on an associate role and stepping away when the income builds. The other issue was always buying too many toys. So it was always getting tons of kit and, as you say, kitting out 2 or 3 rooms and realizing you only needed one at the beginning until your client base built. But generally, my experience has been that it's been amazing, actually. I've seen some really good squat practice set up over those years. Most of my clients fed back to me that it was a tough 18 months. Then after that, they never looked back. So I don't think it's for everyone, but you've definitely got to have a BD hat on. You've got to be ready to drag the new patients in. Generally very, very good experience over the last 20 years.
Yeah, and I think also it's having the right team around you as well. So making sure you've got your dental accountant there, you know, a solicitor who understands dental as well, and having the practice design company, again, that understands the sector. Because, yeah, you can find people out there that are cheaper, but if they don't understand the sector, they won't understand the layout, and it probably will end up costing you more money in the long run. So I think, you know, get the right people around you as part of the project. as well as the finance side. Kevin, we put ourselves in there as well, but just making sure you're talking to the right people who have done it before. Because if you're doing this for the first time, I think it certainly helps to lean on people that have done it before and seen the issues that can come up.
Definitely. Okay, so what have we got for people that are interested in setting up a practice?
Yeah, so if anyone wants to reach out to us to have a chat, if they're just at the start of that journey and thinking about doing it, or maybe a little bit further along, just reach out to us and we'll be happy to have a conversation with them to see where we can assist, really.
And information on the webpage.
There's plenty of information on the webpage that they can have a look through. But again, if they just want that conversation with us, we'll do that. There'll be no initial fee to have a chat with us. We can just sort of help and guide them along in terms of the process.
Brilliant. Thank you.